Heel fissure. What is a heel fissure? Cracked heels, also known as heel fissures, are cracks that occur in the back of the heel, usually on both heels. For some people this can be a chronic problem, which is more annoying than dangerous. However, for some people such as diabetics, people with poor circulation, and people with immunosuppressant diseases, this problem can have major consequences. At times, the cracks can be very painful. What causes a heel fissure? The following will cause heels to dry out and eventually crack. Dry skin, known as xerosis. Disruption in the barrier or protective function of the skin, leading to increased water loss from the epidermis, outer skin layer. Low humidity as seen during the winter. Genetics, some people are prone to dry skin. Additionally, diuretics, water pills eliminate water from the body and can dry out the skin. Decreased sweat gland activity. Dyskeratosis, abnormal formation of keratin layer. Medical conditions, including venous stasis, eczema, diabetes, hypothyroidism, Down syndrome, kidney disease, lymphoma, and malnutrition. Backless shoes. Over the years, I have seen this condition to be more prevalent in heavier people and those that wear backless shoes. Obviously, the heavier you are, the more the heel fat and skin is displaced laterally, even if you wear shoes with a back to them. So what is the big deal about heel fissures? Many people find it to be cosmetically unacceptable, particularly women who wear very dressy shoes. Some people find the heel fissures to be painful. The plot further thickens because these heel fissures are very prone to becoming infected. In an otherwise healthy individual, this problem can be easily remedied. It tends to be more of a problem in diabetics and those with compromised circulation. Treatment of heel fissures. Athlete's foot. What many people, who have chronic dry heels with or without fissuring, do not know is the fact that it is being caused by athlete's foot. Ever wonder why you are putting a ton of dry skin lotion on your feet, and the heels never clear up? More than likely there is also athlete's foot involved. Another scenario that I see is people who wear work boots all day long with their feet perspiring. If athlete's foot is part of the problem causing fissuring, then it is important that the boots be allowed to air out at night, either by being placed by an open window, or on the back porch, etc., in order for air to get inside the boots. Open back shoes. As mentioned earlier, if you are going to insist on wearing open back shoes, you can pretty much rest assured that you will never improve on this problem. Manual removal of heel callus. Having the heavy callus manually removed by a podiatrist dramatically improves the situation. Keratolytic agents. If the callus is so severe that even debriding the growth cannot rid the foot of the callus, I usually will recommend a keratolytic agent for the patient to apply as bedtime and then cover the heel with plastic bags covered with loose socks in an effort to moisturize the area to allow for better penetration of the medication. The better keratolytic agents require a prescription. By reducing the size of the calloused tissue, you are also reducing the depth of the fissure, and that will make them feel better and easier to close. Infected fissures. If the fissures are infected, that has to be addressed as well. For mild infections, topical ointments like bacitracin ointment applied twice a day with a dressing is helpful. Oral antibiotics. For more severe infections or in people at risk, sometimes oral antibiotics are necessary. The other point to come away with here is that in most cases these are chronic conditions. Using the advice given in this video, you can dramatically improve on them, but you will always have to be cognizant of the problem and deal with it on some type of regular basis. Read the complete article at www.fot-pain-explained.com/heel-fissure.html